Hi, everybody. Yesterday in Canada was Bell Let's Talk Day. It was a day to acknowledge and better understand the seriousness of mental illness. It is a mental health disorder that affects the way people think, feel, behave, or interact with others. There is still a lot to understand, but it is treatable. The day was also dedicated to moving mental health forward in Canada. Bell Let's Talk promotes awareness and action with a strategy built on 4 key pillars: fighting the stigma, improving access to care, supporting world-class research, and leading by example in workplace mental health. I'd like to share with you now the following news report, which outlines just how serious a problem mental health is in Canada. 1 in 3 Canadians are struggling with their mental health as the COVID-19 pandemic enters into its 3rd year, according to a new poll from the Angus Reid Institute. Researchers said that the picture of mental health in Canada is one of exhaustion and increasing trauma, as more people reported feeling fatigued, frustrated, and anxious since Omicron became the dominant strain of COVID-19 in the country. 36% of Canadians reported that they have been grappling with mental health issues, up sharply from the 1/4 who said so last November, the Institute said. When asked to summarize how they've been feeling in recent weeks, nearly half, 48% of Canadians polled, said they've been feeling fatigued. Only 1 in 10 survey respondents chose happy, and 23% chose depressed, the Institute added. The data suggests that about 3 in 10 Canadians say they speak regularly about their mental health with friends and family. But those conversations became more scarce among men aged 55 and older. Just 11% in that demographic group say they talk to their friends about how they're feeling, while 1/4, 23%, talk to family, the study reads. However, researchers found that women between the ages of 18 and 54 were much more likely to have this type of discourse. The study also suggests 66% of those who have been struggling with depression and anxiety, or know someone who is, say that it has worsened during the pandemic. These same trends are noted for those who perceive people in their social circle dealing with addictions and alcoholism, the Institute said. The poll was conducted using a representative randomized sample of 1,509 Canadian adults who are members of Angus Reid Forum and carries a possible margin of error, or plus or minus 2.5 percentage points, 19 times out of 20. Now let's move on to the situation in BC with the paramedics and dispatchers. Groups representing Canada's paramedics are calling for improved mental health services as staff shortages and unprecedented call volumes fueled by the pandemic and the overdose crisis take a toll on workers. In British Columbia, BC Emergency Health Services reported more than 840,000 ambulance dispatches in 2021. But the union representing ambulance workers said the figure is probably much higher. Troy Clifford, president of the Ambulance Paramedics BC, estimates paramedics responded to more than 1 million calls last year, pointing out that calls that require multiple ambulances aren't counted as separate events by their employer. These numbers are just not sustainable, said Clifford. Figures released earlier this month by BC Emergency Health Services said BC paramedics responded to nearly 100 overdoses a day in 2021, which Clifford said has taken a toll on the service. The numbers of our members off and in treatment because of psychological injuries is incredible, and the opioid epidemic is definitely a significant part of that, he said. Dave Daines, president of the Paramedic Association of Canada, said ambulance paramedic services across the country are reporting increases in call volume, decreased staff due to COVID-19, and a greater need for mental health resources. The Manitoba Association of Healthcare Professionals representing more than 800 rural paramedics, said in a January 6th report obtained by the union, it showed ambulances were idle for a cumulative 17,000 hours in October due to limited staff. During the pandemic, rural paramedics have worked unprecedented levels of overtime and continue to do so, but they can't keep it up, said Union President Bob Maratz in a release. Syed Norsamar, a spokesperson for the Canadian Union of Public Employees in Ontario, said it surveyed 1,440 of its paramedic members in October, and 92% of respondents said they were understaffed. Norsamar said 84% reported an increased workload was impacting their mental and physical health, while 73% said their employer was not doing enough to address mental health concerns. The Ontario Ministry of Health said in a statement, paramedic services across the province offer services to support the mental health needs of their employees, including family assistance plans, in-house counseling, peer support, and access to publicly funded mental health and addiction services. Robert Parkinson, Health and Wellness Director for the Ambulance Paramedics of BC, said last year's heat dome shifted the need for better mental health resources into focus when record-breaking temperatures overwhelmed the 911 service. The BC Coroner's Service reported a total of 595 heat-related deaths last summer, and Health Minister Adrian Deeks confirmed there were 2,000 ambulance dispatches on June 28th, the highest ever one-day total. Parkinson said the event exposed understaffing issues and brought to light the mental health impacts paramedics and dispatchers face. Ambulance Paramedics of BC said it estimates about 30% of the workforce is accessing psychological support, either through benefits, participating in the Critical Incident Stress Program, or by taking paid time off. BC Emergency Health Services said in a statement that mental health-related claims represented about 46% of all its long-term disability claims in 2020, though 2021 data is not yet available. The BC Health Ministry has said it will offer more clinical supports and resources for frontline staff and their families. It also said it was adding 85 full-time paramedics, 65 dispatchers, and 22 ambulances to the system. Troy Clifford said, if we don't see changes soon, we will continue to see our ability to respond to patients suffer and wait times increase. If you are new to my YouTube channel, don't forget to click the subscribe button down below. It is completely free to do so, and it really helps out my channel. Also, if you like the news and educational videos that I post on a regular basis, please hit the like button down below as well. Just a reminder, if you know of someone who is struggling or going through a tough emotional time, I can be reached directly at dynamicsandhealing@gmail.com. Thank you so much for taking the time to watch this video, and I hope you have a great day, and I'll talk to you again soon. Thanks for watching. Bye.